Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your host Edward McQueen and April Garner Davis.
That's right, we're live. Good evening. Welcome to our program this evening, and hope you're going to be. This is going to be a well attended and much beneficial to our viewers. So I'm your host, co-host Ed McQueen. Of course, the other co-host is Miss April Garner Davis, and she's going to be engineering behind the scenes tonight, which she always does a masterful job at. So this evening, as you saw in our promo, we want to get into this illness. I'm going to say illness, but it's something that's been affecting the community a lot, and we just didn't know how. Well, I speak for myself. I didn't know how to approach things in terms of how to get things started regarding the subject of strokes in the Black community. So we notified our guests and who's going to be with us today to talk to our viewers about the issue of strokes in the community. Okay. First, I just want to let me just list some things about the interesting facts about strokes, according to the U.S. Department of Health and Human Resources. Okay. What our guest is going to come on and further elaborate on these things, but give us some he's going to go into it to kind of break things down for us. Okay, so number one, to start off, that African Americans or Black Americans are 50% more likely to have a stroke, and the medical term they call it is cerebrovascular disease. Okay, as compared to our white adult counterparts. Secondly, Black men are 70% more likely to die from a stroke as compared to non-Hispanic whites. African American women are twice as likely to have a stroke as compared to non-Hispanic white women. Now, those three, I'm calling them warnings that I just listed out there should be enough for us to really take heed to all of these and read a bit more about the issue of strokes, especially in the Black community. Okay, because it's compared to other segments of our society, it seems like we're at the brunt of this, and that's not good. Okay, so without further ado, let's bring on our guest, Dr. Omofoye of Tidelands Hospital, and he is a neurosurgeon at Tidelands, and just having the title of neurosurgeon is enough for me, Doc. to say that we're expecting some good answers and some very informative information to address some of these issues that's not talked about a lot, but it's hitting our community in such a way that it's as if it's expected, and people aren't saying anything about it, how to prevent these kind of things, or something like that. So without further ado, Doc, welcome to the program.
All right, thanks, Mr. McQueen. Yes, thanks for having me on the show. It's my pleasure to be back to talk about this very important topic.
Okay, yeah, I'll alert our audience let our audience know that we've had you here before, back in November. This is what our archives show, November of 23. This is something that we should have regularly, to talk about this issue. Okay, and there are other critical medical issues also that we need to talk about on a more frequent basis, but particularly this one. That and diabetes and high blood pressure, all those things are connected. Right. So before I start talking about that connection, can you just give us a little brief? First, if you want to introduce yourself more thoroughly to the people who didn't listen to us the last time back in 2023, we certainly appreciate it.
Yeah. Thanks for having me again.
Yes, sir.
So my name is Dr. Oluwaseun Omofoye. So I'm a neurosurgeon at Tidelands Health. Operate out of Wakama Hospital in Neurosurgeon, but we also have different physician hospital locations all across the Grand Strand area. So I've been practicing neurosurgery at Tidelands for almost 4 years now. So I came in 2021. And, I deal with any kind of issues involving the brain and the spine. My primary area of expertise is in brain tumors. So I do a lot of brain tumor surgery. But certainly we see our fair share of patients with strokes. We have a neurosciences center that has one of the neurosurgeon and two neurologists. So primarily our neurologists manage most of the stroke patients that we see. But we sometimes collaborate in terms of patient care. So I typically get involved if a patient needs surgery, while neurologists manage patients with brain issues if it can be managed with medications alone.
Okay. Well, see if we can delve a little bit into why there's such a disparity, you think, between the communities, that brought up this issue on stroke with Black Americans.
Yeah, that's a very good question. I don't think anybody has the perfect answer to exactly why that is the case. We do know that stroke has multiple, risk factors, that causes stroke to happen. And before we get into that, I kind of want to talk about what exactly is a stroke. So, a stroke is basically an abnormal, blood flow in the brain that causes cell death to happen, so where brain cells are dying. And there's sort of two main, umbrellas of strokes, in the brain. So the most common type of stroke is called an ischemic stroke, which is it's a blockage of a blood vessel in the brain. And so the brain has multiple blood vessels that carry blood from the heart to supply the brain. And the brain uses a lot of blood, a lot of oxygen. And so if the brain doesn't get enough blood flow, even for a very few minutes, those cells can start to die off. And if there's a blockage in one of those blood vessels, that's called an ischemic stroke, or a blockage type of stroke. And that's about 80% of all strokes that we see is that type. The other type of stroke is called a hemorrhagic stroke, and that's a bleeding stroke when someone has had bleeding in the brain. And that's about 20% of the cases. So not as common, but also can be very devastating. So kind of starting with the ischemic stroke standpoint, there's multiple reasons why we see that, where a blood vessel in the brain can get blocked. The most common reason for that is due to something called atherosclerosis. What that means is just hardening of the walls of a blood vessel. So if you imagine a blood vessel is a pipe, and blood is flowing through it, like water flowing through a pipe. Sometimes those blood vessels can harden, and then the channel of that pipe kind of slowly closes up, and that's one of the primary reasons why we see stroke happens. And the reasons what causes this to happen are things like high blood pressure. That's the most common or the most important risk factor for developing a stroke. So patients that have high blood pressure, over time, all that pressure flowing through that blood hardens the wall of the blood vessel, and that causes it to kind of narrow over time to the point where it can close up, and blood stops flowing into the brain. We do know that in the Black population, there's a high rate of hypertension, of high blood pressure, and that's one of the biggest causes of strokes. I mean, some of this is related to modifiable risk factors, things like diet, exercise. Also, patients that have diabetes, for example, as well. By just having diabetes alone, that increases your risk of developing atherosclerosis. That's the hardening of the walls of the blood vessel, which then increases your risk of stroke. And so we also know diabetes is high in the Black population, or sugar, as some people will call it. In addition to that, one of the other risk factors is smoking. So patients that smoke, this toxins from smoking also hardens the wall of all the blood vessels essentially throughout the body, and that also increases the risk of having stroke. Other things like having a high salt intake diet, diet with high sugar, unsaturated fats, eating lots of fried foods. We know a lot of soul food has, a lot of fried food component to it. So that also kind of plays into that risk. In addition, obesity by itself as well increases, risk of stroke, increases risk of atherosclerosis, increases risk of hypertension. So all of those things are tied together. And we also know there's high rates of obesity in the Black population as well. Another risk factor is high cholesterol. Um, if you have high cholesterol, you can develop plaques, typically fat deposits in the wall of your blood vessels, and over time, those plaques can rupture, and it can cause all of a sudden blockage in the wall of the blood vessel in the brain, and that causes stroke. So those are some of the risk factors and causes for it. Also, if you have a family member who's had a stroke, if parents or siblings have had a stroke, or grandparents, that also puts you at a higher risk of having a stroke. So you want to make sure you're changing those risk factors by watching your diet, making sure you're exercising. If you have diabetes, making sure that is well controlled, and even things like sleep apnea as well can even increase risk of stroke. And
so sleep apnea.
Yep, because we do know that patients that have sleep apnea, so meaning when they sleep, they stop breathing for some seconds or a few minutes, and because of that process of losing oxygen, when the people start breathing, if they snore a lot, that could be a sign of sleep apnea. Sometimes that increases your risk of high blood pressure, increases the risk of stroke. So there's some link there as well. So if you have that, most important thing is making sure you have a primary care doctor, a primary care provider who you're seeing regularly. At least everybody should be getting a checkup once a year. To see a doctor to make sure they're checking all your labs, they're checking your cholesterol levels, checking your blood pressure. If you have a strong family history of high blood pressure, usually I tell patients to get a blood pressure monitor. You can get one from CVS. Check your blood pressure. Even if you're taking blood pressure medications, you can check it once a day or once a week if it's pretty stable, to make sure your blood pressure is within normal limits. Normal blood pressure, typically we want it less than 140/90. So it's two numbers. The top number is 140. Bottom number is 90. So if your blood pressure is usually less than that, most of the time, that reduces your risk of stroke.
So let's go back to a couple of things. One is that you just conveyed a standard that's been set. You said 140 over what, 90?
Over 90, yeah.
Well, it used to be 120 over 80. So what happened?
Yeah, no.
Is that research or what?
No, you're right. Normal blood pressure is 120 over 80. So
right.
If you want to have the perfect blood pressure, yes, that's the case. But the data shows that if it's consistently higher than 140/90 is the upper limit of normal. So there's a range of normal blood pressure, but if it's consistently higher than that, then that means you really need to be on medication for it. So even if if your blood pressure is like, let's say 130s over 85 or something like that, most of the time the primary care doctor would not put you on medications. But if you check it consistently and it's higher than 140/90, that's the sort of danger zone when you start having to, if you're not on medication, you need to be on medication. If you're on medication, then you need to either change your dosage, or you might need more than one medication if it's higher than that. Yeah, but you are correct that 120/90 is sort of the gold standard. But oftentimes patients are not able to meet that gold standard. But if you're within that range, between 120s to, as long as it's not greater than 140/90, then we're usually not too concerned.
So, if it's under 140/90 consistently, under, let's say 130, 135,
right?
Then is that justification for getting medicine for that?
It depends. So that's a great question. So if your blood pressure is let's say 130s over 85 range, and you don't have any other medical problems, you're pretty healthy, you don't have obesity, you don't have diabetes, you don't have high cholesterol, then your primary care doctor might not think you need to be on medication. But if you have a lot of other problems, sometimes we have to look at the whole picture, see what other medical problems you have. If you have family members who've had, heart attacks, who've had strokes, that puts you at a higher risk than somebody who doesn't. So that's why it's important for you to see your primary care doctor so they can look over your medical history, look over your other medical problems, and decide, what's best for you. If you need to be on medication, or if it's something that you can control by changing your diet, changing your weight, exercising more.
Okay, see, it's the first time I've heard about this. I read a lot, I guess, regarding high blood pressure. Every time I go get a checkup, you got literature around that telling you what the gold standard is. You're calling it the gold standard, but that was just standard. They didn't use that nomenclature. But now that I'm hearing, that you were saying 140 over 90 is like an upper limit. I guess, of that range.
Right.
Of that range from one. So a person should be feeling pretty good about 130 then, or 130 over.
Yeah, my blood pressure is usually in the 130s range. So
And you don't take pills, right? I mean,
No. And sometimes when we check it in the hospital or in the clinic, for a lot of patients it's higher than what they get at home, and some of that is due to just anxiety.
Getting to the office.
right. Getting to the office.
Getting to the office, all that can cause your blood pressure to go up.
The white blood syndrome, and that's why I tell patients to check it at home yourself to make sure, that consistently it's within normal limits.
Yeah. Okay. And the other thing, you mentioned one of the as part of the diet, like fats and stuff like that. Food with fats, saturated fat. I'm sure everybody reads if they're if they're concerned about what they're reading and before they eat anything. You see the word polyunsaturated fat and mono unsaturated. Can you kind of give us some clarity on those two?
Yeah, that's a good question. So, I mean, it has to do with basically how your body processes, fat. So, fats that are, polysaturated, they're just more complex, and it takes your body a lot of time to break it down. So things like, if you look at oil, for example, so if you want to kind of grade oil and based on from good to worse, so things like vegetable oil, we do know that sort of plant-based oils tend to be better. So things like corn oil, for example, is a little bit more healthier than animal fat, butter, if you're comparing that to oil. So those are things to watch out for. So if you're frying food, for example, and you're trying to decide what type of oil to use, so you're using the like Crisco oil versus Mazola or corn oil, for example, is healthy. Olive oil is a little bit more healthier. Peanut oil is a little bit healthier than other oil that comes from animal fat, and basically that has to do with how you develop cholesterol, and so things like bacon grease, butter. We do know those are a little bit more complex, and those tend to create more higher risk of atherosclerosis, so the hardening of the walls and your plaques formation, compared to plant-based oils.
But butter tastes better, right?
That's true. Yeah, that is true. It's not the same.
You can't beat that.
And sometimes you can't cut everything out, obviously, but what's important is moderation and making sure you have a balanced diet, and having if you're gonna be eating stuff that has a lot of butter intake, then you want to balance it out with eating lots of fruit, vegetables, exercise. Garner Davis just mentioned exercise. So what's recommended for exercise is to have at least 150 minutes of exercise per week. So, on average, that's about 30 minutes, 5 days a week of moderate exercise, where you're getting your heart rate, up. For patients who have jobs that is sedentary job, if you're working as a secretary or a desk job, there's new research that's showing that if you're getting up at least 5 minutes every hour, that reduces your risk of a lot of the complications. So if you're sitting down for a period of time, just get up 5 minutes, walk around, get some exercise, return back to your job, and doing that regularly every hour, taking that 5-minute break reduces your risk developing some of these problems.
We got a question from a viewer here, Ms. Fuller. She says, "Thank you for this valuable information. Who is at greater risk of stroke, black men or black women?"
Yeah, that's a good question. We do know that black men they're at a higher risk of getting strokes, but black women they have worse outcomes when they do have strokes. And some of this data is sort of mixed, so we don't know exactly what causes it. But one fact that is showing up now is that patients are actually getting strokes at a younger age, which is very concerning. Historically, we used to see patients getting strokes in their 70s, 60s. Now, we're starting to see patients getting strokes at 40s and even 30-year-olds getting strokes, and that's very concerning. And some of that could be their diet has changed over the last decades. Now there are more fast food places available compared to decades ago. A lot of diet is very highly processed food now. And because of that, we know the rates of obesity has increased over the past few decades as well. So some of that has played a role into that. So I think that's more of a concerning issue, is that the fact that younger patients are getting it now as opposed to whether it's male or female.
It's I don't know what you can suggest, but food is I know food is big business, man. Okay.
Right.
And so they're doing everything to enhance the flavor, enhance the taste of food, and especially fast food.
Right.
Most of whatever's labeled as fast food. And fast food, sometimes I think it has its place, because when people are on their way to work in the morning time or something like that, or in the evening, and you have, it used to be a time when our mom just come home and want to cook dinner for the family, stuff like that. You just want to go and just pick it up from the fast food. I can see that happening. Of course, I don't want to get to that point, because I don't do it, but. I've seen that happen, and obviously it's happening a lot.
Yeah, that's a good question, and this is some of the reasons why we do see a higher risk of stroke in in the Black population, because a lot of healthy foods are expensive. A lot of natural, organic, source food are expensive, and fast food are cheaper. And we do know there's higher rates of fast food places in urban communities and minority communities. So, what we can do is just to try to, when we do get options for food, is try to make sure you're getting, healthy dose of vegetables, of fruits mixed in, and trying to cook food at home as much as possible, as opposed to getting fast food all the time. So in terms of going into the symptoms of stroke, so I talked a little bit about the types of stroke. So we talked about the ischemic stroke. That's the one that's caused by blockage. The other type, the 20% type, which is not as common, is the bleeding stroke. And again, the primary cause of that is high blood pressure. So if you have really high blood pressure, the walls of your blood vessel can burst, and that blood sort of spills into the brain, and it creates pressure in the brain, and that causes those brain cells to die off. And what determines the symptoms of stroke is what part of the brain is affected. So there are multiple symptoms of stroke. So, one of the acronyms it's called BFAST, BEFAST. That's acronym for stroke. B is balance.
Right.
So basically, for stroke, the important thing is to know that if it's a change that's happening all of a sudden, all stroke symptoms it's an acute process, meaning it happens all of a sudden. You develop the symptoms, within a second it comes on. If anything abnormal happens all of a sudden, then that should be concerning, and you should be calling 911 to get to the hospital. So the BFAST acronym, the B stands for balance. So if you're having all of a sudden you develop balance difficulties, you can't stand up, you can't walk, you're dragging one leg, that could be a sign of a stroke. And that's because if the stroke is happening in the part of the brain that's called the cerebellum, that's the part of the brain that controls your balance and coordination, it's going to affect that area. So that function is going to be affected. So if someone has all of a sudden balance problems, that could be a stroke in the cerebellum. Sometimes that can also present with all of a sudden nausea, vomiting. If you have difficulty coordination, reaching, grabbing things, you can't hold on to things that that's a worrisome complaint. E is for eyes. So if you have all of a sudden vision problems, that could be a stroke. So if all of a sudden your vision just goes completely black, you can't see, or you notice you can't see half of your vision. So if you can't see things on the right side of your field of your vision, on the left field of your vision, that could be a stroke in the occipital lobe. That's the part of the brain that controls your vision. So if that part of the brain is affected, there's no blood flow there, or there's bleeding in that area, you could lose your vision. All of a sudden, if that happens again, you need to call 911. The F stands for face. So if you start noticing drooping on one side of the face, and that's because the part of the brain that controls movement of the face is affected. Usually, it's just on one side, because if a stroke happens, most of the time is on one side of the brain, and we do it. The left side of the brain controls the right side of the body. So if you all of a sudden notices someone's face is drooping, they can't open one eye, either the corner of their cheek kind of is drooping, they start drooling, that's also a sign of a stroke that you need to go to the hospital right away. And A starts for arm or leg, so any kind of weakness on one side of the body, and or it could also be tingling or numbness. So if anything is affecting the arm, you can't raise your arm up, you can't hold on to things, you're dropping objects all of a sudden, you get weakness in the legs, or if you start noticing numbness, feeling like an arm is falling asleep, or you're feeling like this tingling, people can experience this in different ways. And that's because either the motor cortex, that's the part of the brain that controls movement of the arm or the leg, is affected by that stroke, or the sensory cortex, the part of the brain that controls sensation, being able to feel things on one side, is being affected. That's also a sign for to call 911. S is speech. So the part of the brain controls speech is affected. People can start to slur their words. If they can't get the words out, or they're jumbling words, or they can't speak at all, those are signs of stroke. And then T just stands for time, and that means that one thing that's important is for stroke, the longer you wait, the longer the damage, and the damage can become irreversible. So if you've seen someone with a stroke and they're paralyzed on one side, most of the time that unfortunately may not come back. And because if those brain cells have died off completely, they may not recover. Sometimes if you can get a patient to the hospital within 4.5 hours or so, we can give them a clot busting medication to basically bust the stroke, because the stroke, it's like a clot. Sometimes we can bust that clot up and restore the blood flow to that part of the brain. And because the brain really needs time, that blood flow right away, if we can restore that blood flow, that can cause some of the function that's lost to actually improve. And nowadays, there's a treatment called a thrombectomy. And what that means is we can actually go in and fish out a clot from the brain in the patient who has had a stroke. Within 24 hours now, there's some data that's showing we might be able to do it within 48 hours. But ideally, within 8 hours to 24 hours, sometimes we can still do that. And basically that procedure, they go through the groin. It's kind of like having a heart catheterization done. If anybody has ever had a heart cath, there's a big artery in the groin called the femoral artery. We put a little tube into that artery. It goes all the way around the heart into the big blood vessels in the neck called the carotid artery. And we can actually use a stent to pull the stroke and suction it out. And there have been patients who come in, they're paralyzed on one side. If we can get them in within a few hours and take that clot out, and restore the blood flow, they can recover function. But unfortunately, the longer you wait, the less likely it is to recover function, and that's why the T starting from time is there, is to let you know if you see anybody with any of the symptoms, you need to call 911 immediately. I wouldn't recommend trying to drive somebody to the hospital because sometimes there are medications they can give you during transport. And what typically happens is if you call 911 and the EMS people come to your house, they automatically notify the hospital, let you know, okay, we have somebody with a possible stroke symptoms that's coming. So the hospital is already aware. They're getting the CAT lab ready. So by the time you're arriving into the door, you're getting the CAT scan immediately, and you're going into the IR suite. If you just show up at the hospital, they lose that time to kind of prepare to get things ready. And that's why it's really important if you notice someone's having a stroke, just call 911 so you can get things moving quickly.
So we got a question from the audience, man. Ms. Mayor Scanner Jones, as you can see, says, I decided not to eat, quote unquote, I decided not to eat any fruit without seeds. I realize you can't grow anything without a seed. Is this food grown in a lab? Please elaborate on how this disrespects our diet.
Yeah, that's a good question. We know there are genetically modified foods and things like that. That I wouldn't say they're necessarily grown in a lab, but sometimes with science we can select food that have certain qualities. So for example, we know they're seedless oranges, and that's basically, it doesn't mean they don't have seed. It's just that their seeds are really, really tiny, and over time they've selected for those type of fruit because there's a demand for that. Some people want seedless fruits and
convenience, man.
Right. Convenience.
That's convenience.
Yeah. I mean, it doesn't mean it's bad or it's gonna hurt you. For example, I think it's still better to eat fruits and vegetables as opposed to not eating them at all. But it's just one of those things that over time there's a demand for it, and people have worked towards selecting for fruits that don't have that.
Well, I guess we don't expect you to be an expert at how they do these things in the lab, but just the mere fact that something must have been taken away from a fruit. If you took away its seeds, okay, and it still can be eaten, somewhere down the line, something is missing, man. There's a lack of nutrition there someplace. I mean, you can elaborate on that to a certain extent. I don't know if your ethics prohibit you from doing that or not. I don't know.
No, I just I'm not an expert at that. So, but I think it's just one of those genetically modified foods. We do know that some fruits, for example, that have been modified to select for a certain property. If they're either to be sweeter, corn, for example, there are some sweet corn that over time they've modified it so the sugar content in the corn stays in for long periods of time. But one of the audience questions I want to ask asked about recovery of stroke. So how come some people recover completely after a stroke and other people suffer for long term after stroke? Again, that goes back to what I was talking about, that sometimes time takes a factor. So if a patient comes into the hospital within an hour of having a stroke, most of the time with good treatment, they can recover completely because the damage hasn't taken a long time to take effect. Because if they go to the hospital, they get a clot busting medication that busts the strokes, they recover function. Sometimes that can happen. But if somebody comes to the hospital, let's say they had a stroke overnight and it came the next morning, if the damage is already done to that part of the brain, unfortunately, you might not recover at all. So time is a factor. Age is also a factor. Patients that are younger tend to recover better than older patients, just because when we're younger, our brain is still has some leeway, it's still sort of forming. So, but older patients sometimes tend to have a lot more recovery. It also depends on if they have a lot of other medical problems. So if you have a young patient who, or maybe not necessarily a young patient, but a patient who doesn't have a lot of what we call comorbidities, they don't have a lot of other medical problems, they don't have, diabetes, they don't have high cholesterol, they're not obese, and they get a stroke, those patients tend to recover faster than if a patient has a lot of other medical problems. They have, in addition to the high blood pressure, they have diabetes, which has affected, the blood vessels, how that is able to recover. If they have obesity, poor diet, those patients tend to have a lot more difficulty. Rehab is also very important. So after stroke happens, typically we send patients to a rehab facility because by exercising, working with a physical therapist, occupational therapist, a speech therapist, you can sort of retrain the brain to regain some function. But if the patient after a stroke, either for whatever reason, if they're not able to, sometimes it's insurance. If they don't have good insurance, they don't get to a good rehab facility, or they don't have resources or access and where they live that has a good rehab place. If they just go home and just sit in a wheelchair all the time, they're not really moving those muscles. They're not really retraining, doing a lot of physical activity. We also know those patients tend to do poorly. So after a stroke, it's really good to try to get patients into a good rehab facility where they're going to be working with you, getting you up, making you move those muscles, having social interaction, because you basically have to retrain your brain to do certain things.
Right. Yeah. So here's what April comes up with. She said, "What is a mini stroke?"
Yeah, that's a good question. So a mini stroke is basically a stroke symptoms that resolves within 24 hours.
Okay.
So
Yeah.
let's say all of those symptoms that we discussed, you have balance problems, face, drooping, arm weakness, leg dragging, tingling, numbness, and it goes away, within an hour, within 2 hours, or within 24 hours, and you're back to normal. That's called a mini stroke, or a TIA is the term we use for it. That stands for a transient ischemic attack. And what that means is basically one of the blood vessels in your brain got blocked, but your own blood vessels was able to wash away that clot. And so you naturally have, resolved the stroke. But the danger with that is if you've had a mini stroke, that could be a sign that you might be likely to have a bigger stroke. So we do know patients that have mini stroke, often within the next 24 hours, within the next week, they can get another stroke. So if you've had a mini stroke, it's also important for you to seek care because we need to do some testing. Some of the tests we need to do is looking at your carotid arteries and vessels in the neck, because sometimes you might have plaques in the neck arteries, and a little plaque, breaks off, flows to the brain, and blocks off that brain. But you could have more plaques that could still be coming, and so it's important to get testing. And most of the time, they might put you on a blood thinner, like an aspirin. Sometimes other medications like Eliquis, Coumadin, warfarin, things like that to thin the blood to prevent further strokes from happening. So that's what a mini stroke is.
So, yeah. How long will this blood thinner last? How long should a person stay on the blood thinner?
Yeah, so that's something that you have to discuss with your primary care doctor or
Oh,
neurologist. After a stroke, sometimes if patients have had a major stroke, sometimes they might stay on aspirin for the rest of their life. You know, Sometimes it's more than one medication. They might put you on aspirin and Plavix if it was a big stroke and you have other medical problems.
right, right.
Most of the time, if you've had a stroke, you might have to be on blood thinners for the rest of your life. Only if you have other issues.
Right.
Obviously, there's side effects to any kind of medications, and we have to weigh that risk with other risks. One of the other medical problems I didn't mention is something called AFib, or atrial fibrillation. That's also another risk factor for developing strokes. So atrial fibrillation is when one of the valves in one of the walls of your heart is basically, instead of doing the normal contraction, it basically kind of wiggles around, and there may be a little pocket in your heart that is the blood is pooling in that area, and that can form a clot within the heart. And once you have a clot within the heart, a little clot can break off and cause a stroke. So patients that have atrial fibrillation, we tend to put them on blood thinners to prevent any kind of clot from forming in certain pockets of the heart, and to prevent strokes from happening. So that's one of the other risk factors why patients get strokes.
Yeah, wow. Do we have another question, April? No. Yeah. Are strokes hereditary, or does it depend on your diet?
Yeah, that's a good question. I think it's a little bit of both. Obviously there are genetic, factors for stroke. There are also dietary factors. So we do know that, like I said earlier, I mentioned that having a family history of stroke puts you at a higher risk of stroke. So if both of your parents have high blood pressure, both of your parents have had strokes, you're more likely to have a stroke because the way our genes work. Sometimes some people have genes that doesn't process fat very well, so they might be at a higher risk of forming plaques based on the type of genes they have. And if on top of that you have a poor diet, then you're putting you at a higher risk. We do know there are certain populations, for example. There's a small population in India that they have really small coronary blood vessels, meaning just the blood vessels around their heart is really small compared to the rest of the other population. So there are little things like that based on genes that might put you at higher risk of having strokes. But diet, definitely, we know that diet definitely plays a role too. So it's both things are important.
Yeah. Look, to our audience, this is crucial information. I certainly hope that people are taking this to heart, and and some of the new revelations that it was revelations to me in it regarding, especially the upper limits on what your blood pressure should be. Okay, but this figure of 140 over 95, man. I'm
Over 190.
over 90. Yeah, that's completely out of, on the way left field for me. I always try to work toward 120, 130, 125, stuff like that. And
yeah, and that's a good thing. Yeah, I mean, if you work towards that, then you never get to that upper limit. So, one of the other questions is about alcohol and recreational drugs and how that affects strokes. Yeah, alcohol is one of those things that is obviously multiple data that sometimes is conflicting information. Some people say wine is good for you, or red wine is good for you. It goes back and forth. Most important thing is just in moderation. So what's recommended is that for men, try not to have more than 2 drinks a day of alcohol, and for women, less than 1 drink a day is what's recommended. In terms of recreational drugs, those tend to affect more of the hemorrhagic stroke. That's the bleeding stroke. So we know that patients that use drugs like cocaine or amphetamines, like methamphetamines, have a higher risk of having, hemorrhagic stroke because those things can dramatically, quickly increase blood pressure if you use cocaine or use meth, and that can cause all of a sudden increase in blood pressure, which can cause bleeding in the brain. So those are also risk factors.
so let me just deviate a little bit. How does having adequate dental care, health care, implicates the stroke scenario? I mean, let me reword that. Did you just want some clarify? Having good dental health contributes to stroke prevention in some kind of way, doesn't it?
Yeah, that's a good question. I'm not, aware of.
I know.
Yeah, I'm not aware of any direct links between dental care and and strokes directly. Obviously having good dental care is good for your diet in terms of the things you can eat and stuff like that. But I'm not aware of any direct linkage between both.
Yeah, is the question? I guess the question begs itself: because you're still talking about the head and you're talking about the dental part, especially when in terms of having an abscess or something in your
Yeah.
mouth. You're talking about blood vessels going and
Yeah.
being disturbed, and that leads back to the brain in some regard, right? In some
Yeah.
respect.
Yeah, so I mean, there are cases where, if you have a dental infection or a dental abscess, sometimes, that can spread and become, more severe, where, if you have an abscess in one of the teeth, it can cause, a process in the heart where you get, a little abscess in the heart.
Right.
And sometimes if that happens where you have, called it bacteremia or bacteria, in your heart, in your blood, that can affect the valves of the heart,
Right.
and that affects that, and you get clots around the valves of the heart. Yes, that can cause a stroke from the heart that travels to the brain, and that's something called an embolic stroke, where the stroke travels from the heart to the brain. But I would say that's rare in terms of the causes of stroke. Having a dental abscess causing a stroke, that is rare, but sometimes that can happen.
Yeah. I have. I don't know if this is out of the norm or not, but the issue of vertigo. I've had episodes of that, and I was wondering if that's connected to some issue of the brain in any kind of way.
Yeah. So vertigo is actually has to do with your inner ear. So we have this little, so within the ear system,
Right.
the ear canal, there's
Yeah.
little pockets where that controls your equilibrium. So it's unrelated to stroke, but there are little crystals within the or little stones called otoliths within the ear canal that can get dislodged, and
Right.
sometimes it's that vertigo symptoms where it feels like the room is spinning around you. Typically for that, we can send you to a physical therapist. They can do some movement of the head in certain positions to try to get that crystals lined back in the correct position. Sometimes there are medications, for that. But yeah, it's something that has to do with your brain, your equilibrium, but more so with the ear canal, but unrelated to strokes.
I know that they put for some heart conditions. Surgeons will put stents inside the heart. I don't know what position, but how's
Right.
that? Can you apply that to the brain in any kind of way?
Yes. So the stents that we put in the heart, that's for patients who've had heart attacks, for example. Basically, the same process that I've described happening in the brain. If that's happening in the heart, that's what causes a heart attack. Is the walls of your blood vessels that supplies the heart itself, those narrows and stops blood flow to the heart. And if that happens and the blood vessel is narrowed, we can put a stent in to open up that blood vessel so blood can flow. Most of the time, if we do that in the head, it's usually in the neck. So you have two big pipes of blood vessels that are called the carotid arteries. So if you put your two fingers in your neck, you can actually feel the pulsations. That's your carotid artery. So over time, you can develop plaques in those arteries. And if you do have plaques in those arteries, it can go to the brain and cause an embolic stroke where little plaque blocks off the blood flow. So if you're having symptoms of a stroke or a mini stroke, you want to make sure most of the time they will check that. You either do an ultrasound or a CAT scan of your neck to look at those blood vessels. And if they're really narrowed, if they're usually greater than 70, 80%, stenosis, that's narrowing, then we can put a stent in into the heart to open it up. Sometimes it can actually do a surgery where we make a cut on the neck and actually completely cut that carotid artery open, take out all the clot and sew it back. That's called a CEA, or carotid endarterectomy is the term for that. Sometimes we put stents in the blood vessels in the brain. That's usually for a different process, where if you have an aneurysm, we didn't really talk about aneurysms, but that's a weakening in the wall of your blood vessel. That also has to do with high blood pressure. And if a part of your blood vessel is weak and balloons out, it can actually burst and causes the hemorrhagic stroke like we talked about. So if we see a weak spot in the wall of your blood vessel, we can actually go in and put a sort of like it's called a stent, or a pipeline in there to reduce blood flow into that weak spot. So sometimes we do that as well.
So will a body scan determine that? Will that show up with a weak spot on your brain?
The CAT scan, yeah. Most of the
CAT
time
scan?
we get a CAT scan or an MRI. Technically it's called a CTA or MRA at the term
Right.
for angiogram. Yeah. So for patients who have that, it's usually if they have a really severe headache. It's usually the worst headache of their life. If that happens, you need to call 911 as well. That could be a sign of an aneurysm.
Okay, man. I think we got another question here. Another comment from our audience. Said, does stress increase chances of stroke?
Yeah, that's another great question, Mary. So it does, and part of the reasons why stroke is high in the Black population can also, some of it can be attributed to stress. So we do know that patients who are under chronic stress for different reasons, if you're going through a lot from a social standpoint, family standpoint, work standpoint, and you're chronically stressed, we do know that if you have chronic stress, that increases inflammation, rates in your body, and we do know inflammation is linked to atherosclerosis and this other causes. And one of the sort of social aspect of this is racism, for example. I've been shown that the impact of trauma from racism over time could play a role in terms of why risk of stroke is high in the Black community. But yes, anything you can do to reduce stress in your daily personal life, having good social support, having social support like a church community, a place where you can de-stress, mindfulness, meditation, things like that, prayer, including all of that. Anything that reduces your levels of chronic stress also reduces your risk of stroke.
I like the words you use, de-stress. I think you said that, right?
Right.
I like that. Any place that can de-stress, that you can de-stress, that's important. And that's very critical. So, to our doc, the hour is almost upon us, and it is upon us. And with this kind of information, man, and these questions and comments keep coming in. What does that tell us, Doc? That means that we got to talk a bit more about that on the next go round.
Yeah, definitely. I think having knowledge is important.
Absolutely.
Knowing the symptoms like we talked about, and then things you can do to prevent it, like we talked about. Scheduling appointments with your primary care doctor on an annual basis, checking your blood pressure regularly, exercising, watching your diet, limiting alcohol intake. If you smoke, working on quitting smoking. Those are important things to consider.
Smoking. Glad you brought that up too. Some people just can't stop, man.
Yeah, it's tough. It's a addiction. But I think working with your primary care doctor, there are medications to quit smoking, and there are lots of different resources out there. There are quit lines that you can call. But yeah, those are things.
So, all right. On that note, Doc, we're gonna say we're finished tonight. We're go into the comments after you. Yeah, some more comments after you leave the show because the hour is up. It's man, this has been very informative broadcast tonight. All of our broadcasts are informative because we usually have a guest.
Hey, it looks like Brother Edward is frozen.
I should be back on now.
Okay.
They were left for a while. I don't know what happened.
I can hear you now.
Internet probably went out a little bit. I paid my bill last month. But anyway, so well, thank you so much for coming on, and hope to have you on again. You're going to bring in some new revelations on stroke and addressing the issue of stroke, and they're scientists are continually working every day on
Yep.
trying to deal with this issue. Okay, so until we meet again, Doc. Thank you so much, and we appreciate it. I'm sure the audience appreciates all the information that you've conveyed to them. And what can we say?
All right, thanks for having me on, and yeah, I'm happy to do it. Any other time. If there are any questions, all the audience members can feel free to reach out to me
Right.
through the link.
Okay, and to our audience, we have some very important information, local information that we would like to convey to you in terms of announcements and stuff like that. So if everybody will stick with us while the good doc is gone, we'll certainly appreciate it. Okay. Okay. Thank you so much. So, to our audience, we're still live, all right? So, wanted to make an announcement, not an announcement, but give you an update on what transpired this past. Well, first of all, you see running across the screen is about the Gullah TSIP. It's Saturday, April 19th from noon, 2 p.m. noon to 2 p.m. I think that's this Saturday coming. Okay, it's the tea and sip and the paint at $30 per person, and the proceeds are going to the summer literacy program. This is headed by none other than the icon of Conway, Mrs. Margie McIver, and guarantee it'll be worth your investment. You're going to see the different teas. That's what I believe. We've seen them. Well, at least I've seen them, and I'm terribly impressed because I like to drink tea, especially green tea. But I think it's good. I believe it involves tea tasting, and I think food is going to be served. Okay, so be there. It's just $30 per person. And that's for investment. You're investing into the community because the proceeds are going to the summer literacy program. Okay. So, having said that, Ms. McIver also headed this past weekend. I wanted to get an on a post comment on that. It's because it was so successful at Friendship. Well, there you go, the contact for Ms. McIver at 843-907-1406. That's 843-907-1406. This is for the Gullah T-SIP and paint, okay? Again, it's going to the Summer Literacy Program. That fantastic program has been going on for a while, and you should see some raw results, man. You'd be amazed. One of these days, we're gonna show all our results, okay? Of her results. From that the summer literacy program. This past, as I was saying, this past Sunday at 4 p.m. This was at Friendship Missionary Baptist Church. They had a synopsis of what the Project 2025 looks like and what we all should be aware of, and it was very, very interesting. Of course, judged by the audience, the size of the crowd that was there, everybody was interested, right? She indicated that this involved the dismantling of the Department of Education, and that's what the topic was on a national level. And some of the issues that came up with serious implications of what could be happening, especially in our communities, that they got the bannings of books in schools, major cutting the staff in the schools, eliminating services in students with special needs. That was highly discussed. Okay, eliminating or watering down African American history and other curriculum areas. Okay, so just wanted to give you a review of that to let you know how important these things are, and we have meetings like that and urgent meetings for concerned citizens, parents and grandparents and caregivers, all that. We had Brother Eugene Bellamy, who was there to talk about it's how this thing is going to be impacting the schools, and of course they had Miss Juliana Brown, Miss Dolores Rozier, all had just pure critical information that we all need to know about, because there's going to be some cutbacks coming down the pipe, and if this doesn't bring you all together to reach a common ground, I don't know what will. Okay, so the objective, or whether it was proposed that after this meeting, was that they have them more often, more frequently, and preferably every quarter. As far as if it were me, I'd have them every month, because you're going to need them every month. Okay, but at least every quarter. So that's what they're looking at. They're exploring some of those things, and we just wanted to give you the highlight of how it transpired, and see what you missed if you were not there. So the next one that comes up, hopefully very, very, very soon, and we're going to keep you abreasted. Okay, we will show you what the proposal will be. Okay, we had just I'm trying to put a figure on the number of people that were there. I guess next week I'll bring some photos. Okay, we'll bring some photos and show you what the audience, the participation of the audience, and their impression, if you will, of what transpired. It was just very, very informative. Okay, very informative, and thanks again to Reverend P, who allowed this to go on, and all of the people in Horry County who attended. I'm sure. Oh yeah, food was served. Okay, but that's not shouldn't be the attraction to get you there. Your children, the interest of your children, should be the attraction for getting you there. But food was served. They had takeout bags, and that's just added to the luxury. Okay, it's added to the delight. Fantastic food. Again, kudos to Miss McIver, Miss Margie McIver, Miss Juliana Brown, and Miss Dolores Rozier. The other all of this also has to do with our summer jobs programs also. Okay, it wasn't elaborated there, but I just want to let you know that we're going to need your help. Okay, our summer jobs program from ages from 14 to 17. If we have to bend a little bit to get you from that 18, if you just pass it 17, just turned 18, and you need a summer jobs, we're gonna we'll get you on. Okay, we have a number of places that have committed to and just bringing you on. And you're going to be working for 5 weeks, I believe 6 weeks, and it was just drawing a paycheck. We'll let you see what it's like to drawing a paycheck and working. Okay, we have a goal of about 40 students this time. Last year we did not have it again, but because of a lack of administration. It wasn't a lack of funding, but a lack of administrative help. So this year we hope to not have that issue. Okay. Again, so that's our summer job program. You're going to pretty soon. You're going to be maybe within the next week. You'll be getting letters out and asking you for your help and directing us to entities that could help us to facilitate this summer job program again and make it as successful as in the years past. We've had as high as 75 students. Okay, really 75 students. And kudos to all those people who helped us with that, or having that. Okay, so again, just look forward to it. You'll be getting something in the mail, and we'll have it on Facebook if we can, and indicating how you can help. All right, so thank you and Godspeed. Thanks to our audience. Thanks to all of our commenters, our people who sent in information and questions that they want to know about from Dr. Omofoye. Okay. So we'll see you next week. Godspeed, God willing. And good night. We'll see you next week.
Thank you for watching the World Community Magazine's Hour of Power Live on Facebook.